Are you tired of that constant urge to rush to the bathroom? Do you find it challenging to enjoy an outing without worrying about finding a restroom? If so, Tolterodine Pixorize may be the solution you've been looking for. Tolterodine Pixorize is a medication commonly prescribed to treat overactive bladder (OAB) symptoms, such as frequent urination, urgency, and incontinence. It helps to relax the muscles in the bladder, reducing the urge to urinate and improving bladder control. With Tolterodine Pixorize, you can regain control of your bladder and improve your overall comfort and quality of life. Say goodbye to those embarrassing leaks and constant bathroom breaks. By taking this medication as directed by your healthcare professional, you can experience optimal bladder function and enjoy a more carefree lifestyle. Don't let an overactive bladder hold you back any longer. Discover the benefits of Tolterodine Pixorize and say hello to uninterrupted activities and peaceful nights of sleep. Consult with your doctor today to see if Tolterodine Pixorize is right for you. What is Tolterodine Pixorize? Tolterodine Pixorize is a medication that belongs to a class of drugs called antimuscarinics. It is primarily used to treat overactive bladder (OAB) symptoms such as frequent urination, urgency, and incontinence. OAB is a condition characterized by an uncontrollable urge to urinate, often resulting in increased frequency of bathroom trips and occasional leakage. Tolterodine Pixorize works by blocking certain receptors in the bladder muscles, preventing them from contracting excessively. This relaxation of the bladder muscles helps reduce the urge to urinate and improves bladder control. It is available in the form of oral tablets and is typically taken once or twice a day, as prescribed by your healthcare professional. It's important to note that Tolterodine Pixorize is not a cure for OAB but rather a management tool to help alleviate its symptoms. It can significantly improve your quality of life by reducing the frequency of bathroom visits and the occurrence of embarrassing leaks. Understanding bladder function and common issues. Before delving into the common uses of Tolterodine Pixorize, it's essential to understand how the bladder functions and the common issues that can arise. The bladder is a hollow organ located in the pelvis that stores urine until it is ready to be released. The muscles of the bladder wall contract and relax to control the flow of urine. However, certain factors can disrupt the normal functioning of the bladder, leading to various bladder issues. One common condition is overactive bladder, OAB, which we mentioned earlier. OAB is characterized by a sudden and uncontrollable urge to urinate, often accompanied by frequent urination and occasional incontinence. Another common bladder issue is urinary incontinence, which refers to the involuntary leakage of urine. This can occur due to weakened pelvic floor muscles, nerve damage, or other underlying conditions. Incontinence can significantly impact a person's daily life, causing embarrassment, anxiety, and a loss of confidence. Fortunately, medications like Tolterodine Pixorize can help manage these bladder issues and provide relief from the associated symptoms. By understanding the common uses of Tolterodine Pixorize, you can determine if it is the right choice for your specific needs. Common uses of Tolterodine Pixorize. Tolterodine Pixorize is primarily prescribed to treat the symptoms of overactive bladder, OAB, including frequent urination, urgency, and incontinence. It helps relax the muscles in the bladder, reducing the urge to urinate and improving bladder control. Frequent urination. One of the primary symptoms of OAB is frequent urination, which can significantly disrupt daily activities and reduce overall comfort. Tolterodine Pixorize can help reduce the frequency of bathroom visits, allowing individuals to regain control over their bladder and enjoy uninterrupted activities. Urgency. OAB often causes a sudden and strong urge to urinate, even when the bladder isn't full. This urgency can be inconvenient and may lead to anxiety or embarrassment. Tolterodine Pixorize helps to alleviate this urgency, providing individuals with more time to reach a restroom and reducing the risk of accidents. Incontinence. Incontinence refers to the involuntary leakage of urine, which can occur due to weakened bladder muscles or other underlying conditions. Tolterodine Pixorize helps improve bladder control, reducing the occurrence of incontinence episodes and allowing individuals to feel more confident and secure in their daily activities. By addressing these common OAB symptoms, Tolterodine Pixorize can significantly improve the quality of life for individuals dealing with an overactive bladder. It offers a solution to those who have been struggling with constant bathroom trips, urgency, and occasional leaks. How Tolterodine Pixorize works. Tolterodine Pixorize works by selectively blocking certain receptors known as muscarinic receptors. These receptors are responsible for transmitting signals that cause the bladder muscles to contract. By blocking these receptors, Tolterodine Pixorize helps to relax the bladder muscles, reducing the urge to urinate and improving bladder control. When taken orally, Tolterodine Pixorize is absorbed into the bloodstream and reaches the bladder, where it exerts its effects. It is important to follow the prescribed dosage and schedule provided by your healthcare professional to ensure optimal results. Tolterodine Pixorize comes in different strengths, and the appropriate dosage will depend on various factors such as your medical history, overall health, and the severity of your OAB symptoms. It is crucial to consult with your doctor to determine the right dosage and to discuss any potential interactions with other medications you may be taking. Benefits and side effects of Tolterodine Pixorize. Like any medication, Tolterodine Pixorize has both benefits and potential side effects. Understanding these can help you make an informed decision about whether it is the right choice for you. Benefits. Improved bladder control. The primary benefit of Tolterodine Pixorize is improved bladder control. By reducing the urge to urinate and relaxing the bladder muscles, it helps individuals regain control over their bladder and reduces the frequency of bathroom visits. Reduced urgency. Tolterodine Pixorize helps alleviate the sudden and strong urgency to urinate commonly experienced by individuals with OAB. This reduces the anxiety and inconvenience associated with having to rush to a restroom. Decreased incontinence. Incontinence can be embarrassing and disruptive to daily life. Tolterodine Pixorize can significantly reduce the occurrence of incontinence episodes, allowing individuals to feel more confident and secure in their daily activities. Side effects. Dry mouth. One common side effect of Tolterodine Pixorize is dry mouth. This can be managed by staying hydrated, chewing sugar-free gum, or using saliva substitutes. Constipation. Tolterodine Pixorize can cause constipation in some individuals. It is important to maintain a healthy diet, drink plenty of fluids, and engage in regular physical activity to help prevent or alleviate this side effect. Blurry vision. In rare cases, Tolterodine Pixorize may cause blurry vision or difficulty focusing. If you experience any changes in your vision while taking this medication, it is important to consult with your healthcare professional. Dizziness. Some individuals may experience dizziness while taking Tolterodine Pixorize. It is recommended to avoid activities that require alertness, such as driving or operating heavy machinery, until you know how the medication affects you. It is important to note that not everyone will experience these side effects, and they may vary in severity from individual to individual. If you have any concerns about the potential side effects of Tolterodine Pixorize, it is important to discuss them with your healthcare professional. Tips for optimal bladder function and comfort. In addition to taking Tolterodine Pixorize as prescribed, there are several tips and lifestyle changes that can help improve bladder function and overall comfort. These include: maintain a healthy weight. Excess weight can put additional pressure on the bladder, exacerbating OAB symptoms. Maintaining a healthy weight through regular exercise and a balanced diet can help alleviate these symptoms. Practice pelvic floor exercises. Strengthening the pelvic floor muscles can improve bladder control. Pelvic floor exercises, also known as Kegels, involve contracting and relaxing the muscles used to control urination. Consult with a healthcare professional for guidance on performing these exercises correctly. Manage fluid intake. While it is important to stay hydrated, excessive fluid intake can increase the frequency of bathroom visits. It can be helpful to spread out fluid intake throughout the day and limit intake in the evening to reduce nighttime bathroom trips. Avoid bladder irritants. Certain foods and beverages can irritate the bladder and worsen OAB symptoms. These include caffeine, alcohol, spicy foods, and artificial sweeteners. Limiting or avoiding these irritants can help improve bladder function and comfort. Practice timed voiding. Timed voiding involves scheduling regular bathroom trips, even if you do not feel the urge to urinate. This can help train your bladder to hold urine for longer periods, reducing the frequency of bathroom visits. By incorporating these tips into your daily routine, you can complement the effects of Tolterodine Pixorize and optimize your bladder function and comfort. Other treatment options for bladder issues. While Tolterodine Pixorize is an effective medication for managing overactive bladder, OAB, there are other treatment options available depending on your specific needs and preferences. These include behavioral therapies. Behavioral therapies, such as bladder training and biofeedback, focus on retraining the bladder and strengthening the pelvic floor muscles. These therapies can be effective in improving bladder control and reducing OAB symptoms. Physical therapy. Physical therapy techniques, such as pelvic floor muscle exercises and manual therapy, can help improve bladder control and reduce urinary incontinence. A physical therapist specializing in pelvic health can provide personalized treatment plans. Surgical interventions. In severe cases of OAB that do not respond to conservative treatments, surgical interventions may be considered. These can include procedures such as bladder augmentation or the implantation of a bladder pacemaker. Alternative therapies. Some individuals find relief from OAB symptoms through alternative therapies such as acupuncture, herbal supplements, or bladder retraining techniques. It is important to consult with a healthcare professional before trying any alternative therapies to ensure their safety and effectiveness. The choice of treatment will depend on various factors, including the severity of your symptoms, underlying causes, and your preferences. It is important to discuss all available options with your healthcare professional to determine the best course of action for your specific situation. Frequently asked questions about Tolterodine Pixorize. How long does it take for Tolterodine Pixorize to start working? The onset of action for Tolterodine Pixorize can vary from person to person. Some individuals may notice improvements in their symptoms within a few days, while others may require several weeks. It is important to be patient and continue taking the medication as prescribed. Can Tolterodine Pixorize be taken with other medications? It is important to inform your healthcare professional about all the medications you are currently taking, including over-the-counter medications and supplements. Some medications may interact with Tolterodine Pixorize, potentially affecting its effectiveness or increasing the risk of side effects. Can Tolterodine Pixorize be used during pregnancy or while breastfeeding? Tolterodine Pixorize is not recommended for use during pregnancy or while breastfeeding. It is important to discuss alternative treatment options with your healthcare professional if you are pregnant or planning to become pregnant. Are there any long-term effects of taking Tolterodine Pixorize? Tolterodine Pixorize is generally well tolerated, and there are no known long-term effects associated with its use. However, it is important to follow up with your healthcare professional regularly to monitor the effectiveness of the medication and address any potential concerns. Can Tolterodine Pixorize cure overactive bladder? Tolterodine Pixorize is not a cure for overactive bladder but rather a management tool to help alleviate its symptoms. It can significantly improve bladder control and reduce the frequency of bathroom visits, but the underlying causes of OAB may require additional treatment or lifestyle modifications. It is important to consult with your healthcare professional for personalized answers to your specific questions and concerns about Tolterodine Pixorize. How to talk to your doctor about Tolterodine Pixorize. If you are experiencing symptoms of overactive bladder, OAB, and are interested in trying Tolterodine Pixorize, it is important to have an open and honest conversation with your healthcare professional. Here are some tips to help you navigate this discussion. Prepare ahead of time. Make a list of your symptoms, concerns, and any questions you may have about Tolterodine Pixorize. This will ensure that you cover all the necessary information during your appointment. Be honest about your symptoms. Describe your symptoms in detail, including their severity, frequency, and impact on your daily life. This will help your doctor assess your condition and determine if Tolterodine Pixorize is the right choice for you. Discuss your medical history. Inform your doctor about any past or present medical conditions, allergies, or medications you are taking. This will help them assess the potential interactions or contraindications of Tolterodine Pixorize. Ask about alternative treatment options. Inquire about other treatment options for OAB and their potential benefits and risks. Your doctor can provide you with information on behavioral therapies, physical therapy, or surgical interventions that may be appropriate for your specific needs. Address any concerns or questions. If you have any concerns or questions about Tolterodine Pixorize, such as its potential side effects or long-term effects, don't hesitate to ask. Your doctor is there to provide you with the necessary information and support.